Hi everyone, this is Dr. Krishnan.K, and today we have another clinical anatomy query in hand. So let's see the clinical presentation and let's find out the reasons behind it. So today's topic of discussion is golfer's elbow or the medial epicondylitis. So the patient will be coming to you complaining about a pain and tenderness in the medial aspect of the elbow joint. So here in this diagrammatic representation, you can see this is the point where the medial epicondyle will be present, and that is nothing but the origin point of the flexor compartment of muscles in the forearm. So the patient will complain of pain and tenderness in the region as well as associated stiffness in the movements of the forearm and the wrist. And there will be associated weakness which is pertaining to the forearm region and numbness or tingling sensation on the medial aspect of the forearm as well. So these are the typical presentations of golfer's elbow or the medial epicondylitis. So let's turn the pro-anatomy mode on to identify the causes behind these particular conditions. So the golfer's elbow or the medial epicondylitis, the reasons behind it can be classified into two. One is the sports related reasons and the other causes. So the sport related causes, which are typically, it has got the name golfer's elbow from it affecting the golfers more predominantly. So when you take the golfers, there are chances for repeated strain happening on the medial epicondyle region because of the flexor compartment muscles being stretched too much. And that's why that is called as the golfer's elbow. And even including the other racket sports like tennis and badminton, in all those sports also, there will be repeated strain happening to the flexor compartment, and that can in turn cause the golfer's elbow or medial epicondylitis. And the other causes may include the weight training. The practice of weight training without the proper techniques can put too much strain over the flexor compartment muscles, and that can in turn cause the medial epicondylitis or the golfer's elbow. And similarly, any occupation that gives repetitive movements to this particular compartment of muscles or the flexor compartment of the forearm, like in construction, plumbing, and carpentry, all these cases, like there will be repeated strain happening to the common origin tendon of flexor compartment and in turn causing the golfer's elbow or the medial epicondylitis. So here, let's have a closer look at the anatomy over there, where you can clearly see the superficial muscles of the flexor compartment here. They are commonly arising from the medial epicondyle, that is the lower end of humerus, what you can observe here. So when repeated strain is happening to the common origin tendon of this particular flexor compartment muscles, that will put repeated strain injuries over there, and that causes the inflammation of the common flexor origin, and that condition is called as the medial epicondylitis or the golfer's elbow. And I repeat, it's not limited to the golfers. It can also affect tennis players and others who repeatedly use their wrist and clench their fingers. So any repeated motion that puts strain over this flexor compartment muscles and its common flexor origin, that can in turn cause the golfer's elbow. So this concludes today's session on the golfer's elbow or the medial epicondylitis. And if you have any further clinical anatomy queries, do post them in the comment box below, and that will be answered soon through the Pro Anatomy Help Desk. Thank you.